Welcome back to the Connect Show, Texas. If you are just joining us today, this is our comeback episode. And joining us today is one of our very favorite guests, Austin's own PSI, Dr. Booth. He's here today to help us raise awareness for Breast Cancer Awareness Month. Welcome back to the show, Dr. Booth.
Thanks for having me, Wendy. Linda, nice to meet you.
Hello there. You're looking very dapper today, Dr. Booth.
Thanks. I just try and keep up.
You're doing a great job at it. So, for those that don't know, Austin PSI is amongst the most sought after prestigious plastic surgery clinics in Texas. And Dr. Booth, Austin PSI has been around for 20 plus years. Have you had much experience dealing with breast cancer survivors?
Yes, Wendy, it is because breast cancer is very common. We've seen lots of breast cancer survivors, and breast reconstruction is one of the things that we're committed to providing to the community. So not only is October Breast Cancer Awareness Month, but in a couple of days, we also have breast reconstruction awareness. And so that one of the goals is to not only help patients understand understanding their risk for breast cancer and breast cancer screening and the need for that, but also their options for breast reconstruction.
So, Doc, at such a vulnerable time like that in your patients' lives, I'm sure they want to get back to normalcy as soon as possible. What are some of the options they have as far as reconstructive surgery after breast cancer?
Well, and then that's a great question, and that's a very long-winded answer that I could give you, but there's different types of breast reconstruction, and there's not one reconstruction that's right for everyone. So there's reconstruction that involves implants, there's reconstruction that involves taking fat and putting in, and there's options for using your own tissue, which is very common. And so it just depends on what space the patient is in, emotionally, physically, and what therapies they might be undergoing. And so that is something that's tailored to every patient.
That's fair enough. How long would you say, I know it's specific to each patient, but if you could give a roundabout, how long is recovery after these reconstructive procedures, as well as do you aid your clients with recovery?
Yeah, another great question. So in general, if you're using implants for reconstruction, it's a couple weeks for recovery. If we're using, and also it depends on if we're doing, if it's at the same time as a mastectomy. So that also will, increase the recovery time a little bit. And then if we're doing tissue-based reconstruction, so one of the common things is what's called a deep flap, where we do basically a tummy tuck and use the tissue from the abdomen to reconstruct the breast. That recovery is a little bit longer, usually more like 6 weeks. And then as far as aiding them after reconstruction, my office is amazing at helping walking the patients through this process, and we're at the other end of the breast cancer spectrum, right? The cancer's out, and so this is the time that we get to focus on healing and getting them to the next step, and so that's one of the very rewarding parts of our practice.
And what I appreciate most is the fact that not only are you getting them to that point, but your staff actually strives to make the patients feel like family. You also have a reputation for performing more breast augmentation procedures than anyone else in the Austin area. So for those that may not live in Austin and perhaps are watching from West Texas, because I know they are there any travel accommodations to consider? What's the post-op care like?
So typically patients we have some partnerships with local hotels, and we also have some arrangements with nursing that can provide post-op care. And honestly, we do have a few patients from out of town, and I've learned that a lot of them like to stay at Airbnbs and VRBOs, which has been real common lately. And then just bring a friend, or we can hire a nurse to come stay with them. Typically, if it involves a flight, we'll have patients stay for about a week. And it also just depends on kind of the magnitude of the procedure that they're having.
We can't thank you enough for joining us today, Dr. Booth. It's always a pleasure to have you with us. How can our viewers search for you? How can they go about making an appointment for a consultation with you and come see you?
Well, thank you, Wendy and London. It's always such a pleasure to be here. Viewers can reach out to us on social media. at Dr. Booth Plastic Surgery. Our website is austinpsi.com, or they can call us. My office number is 512-755-8478. I look forward to hearing from you.
Thank you very much again, Dr. Booth. I hope that you will be getting lots of calls, and women and men both will be on their way to looking and feeling absolutely their best. So don't you move. When we come back, we will have yet another comeback story with teacher, journalist, and social media strategist Christine Morton.